I am a 28-year-old St. Joe's alum, class of 2017. I grew up in South Philly, attended prep charter high school. When I was at St. Joe's, I majored in bio. I had minors in behavioral neuroscience and healthcare ethics. And I was pre-med for most of my academic career, and I followed that path from St. Joe's immediately with the prereqs, the MCATs, all the way up until the application cycle opening day. But then some of the experience I had in grad school sort of shaped things a little bit differently, and then it took me to this wonderful career I have now. Graduated in 2017. Um, was again pre-med the whole way through, and then I knew that I had some more experience to gain immediately before entering any application cycles. So that was the main driving factor that led me to pursue grad school. So I did. I wanted to do something different though, which I think was a really important point that I'll touch on throughout this discussion. But that desire to do something different pointed me to a sort of a non-traditional um, grad program, and that's the Alliance for Catholic Ed with Notre Dame. And it was completely different than anything I'd ever known environment wise out in the Midwest. And you know, being in Philly, City Line Ave buses, out in cornfields in Indiana, just really different. So a lot of fear there, and just a lot of fear not really in initially seeing how it's all going to connect together and how it's going to lead to something enjoyable, fulfilling, and something that'll also give me good means to live. So just not really sure from the onset what the outcome would be. But I still had some idea that this would be transformative. Finished grad school in 2019, came back to Philly, and I said, all right, great, we're ready for the application cycle. Let me just get back into a clinical role. Um, I'd spent the last 2 years as a chemistry teacher. And then going from that to the emergency room was actually at Lincoln. I was an ER tech there for almost a year, jumping right in there while the cycle was going and getting ready to apply. I um I got to experience what it actually was like to be a physician, in a way that I had something to compare it to in the adult world, such like a working job actually, um, and seeing comparatively how the stress levels and the duties, the roles, the responsibilities, how they fit in with the kind of lifestyle I wanted personally, and the kinds of efforts that I was willing to put in at that time. So that experience in the ER, it was the beginning where I was like, okay, um, what else is there for me? I've experienced teaching. I've gotten this really personal look with medicine and the clinician role, um, working with the providers, overnight shift, 7P to 7A, seeing all types of things come in, and then reflecting on those 2 years in grad school, thinking about the future, where I wanted to go, and seeing where's the best lane for me in terms of lifestyle with fulfillment. I would say it was more so sequential over time. I thought when I was in the ER, I thought this is great. I thought this is cool. I love it. Getting the applications ready, but then as I'm talking with many different types of practitioners, many like different surgeons, different departments, and different floors, different units, and I'm thinking about I'm seeing personally over time because it's sort of like watching a real life experiment. We're all science majors. Over time, you can observe things to observe in any type of experiment, so to speak. And I saw how how these physicians were operating, and just sort of like how how I wanted to live my life. And over a period of that year, I think it happened. It can be difficult, but it can also be freeing. So I want to give um, when I made that initial pivot, I heard so many things from you're wasting your talent, or like, why did you go through all that? Like, you wasted all the effort on the MCAT, like you did good, it'd be a waste. Like I've heard it all. But I think the most important thing to remember when you're making that pivot is, when we leave St. Joe's, when we leave grad school, the rest of your adulthood is you trying to figure this out for yourself and create the kind of life and career that you will be happy in personally. And that means you have personal experiences that only you can um, speak to or attest to because you live them. And so you really have to trust on that and bank on that and lean into some discomfort to not knowing the next steps because I'd had no idea I would end up at Merck doing supply chain engineering work, but I enjoy it immensely. I'm very fulfilled. I'm extremely happy, and I live a very great life. And I would not have been able to get to this point without taking that leap of faith and being okay with some uncertainty in the process and letting yourself feel fear, feel hesitation, and then just always being proactive in the journey. I'm now a supplier change control engineer at Merck through contract, meaning that I sign on a per year basis. My job is to support technical operations linked with supplier changes that keep drug development moving compliantly and smoothly and on schedule. So I'm working mostly through GMP systems, meaning that systems that the government sets to make sure that drugs are being produced at a certain consistency and quality. And it's such an amazing variety of excitement that comes through my job. I'm working on things that impact regulations in Mexico, Japan, and then I'm doing some things that impact um, you know drug products like that we're all familiar with, like Gardasil or Combavax or Vac. These are vaccines that are saving lives and have saved lives all over the country and the world. And to be a part of that is immensely humbling and honoring. And the actual nature of the work is like a scavenger hunt. If you enjoy, you know, uh, process engineering, problem solving, really critical thinking, and creating solutions to problems where there may not be one readily, and working in a team, then this is the kind of work that you can wake up every day and be excited about, and that's the case for me. Critical thinking, problem solving, communication, planning, time management. Those are a good five. So critical thinking, just being able to get a problem and having a finite amount of resources and an incomplete set of data, you think to yourself, how are we going to make a solution that falls within the parameters that I have to work with? It's like a mental Tetris, and it's a very it can be frustrating at times, but it's a very enjoyable and rewarding skill to have because when you think critically in this specific role, you get to see tangible results of that, which I think is cool. Time management. Oftentimes, I'm working on 35, 36 plus different supplier changes, and I'm also writing technical memos to extend um, certain raw materials for usage. So it's all about being able to plan your time and being able to meet goals within certain time constrictions. And then multitasking, we're doing all these different things for multiple different products. Merck makes multiple different products, and so we're supporting as many as five or six different products. Some are live, some are experimental. So just being able to sort of keep things organized, I would list that as another skill as well, organization, so that everything is right where you need it when you need it, and you can access it readily and on the go in meetings or calls or even for your own personal reference. And then communication. We're talking with people in many different departments, many different, we call them here at Merck IPTs. And so I'm in shared services, technical operations with the systems engineers. And then we're also communicating with planners who are placing the POs for the materials that we work on. And they're communicating with the global team who's passing on the information to the different Merck sites all over the world. So just being able to take complex information and present it in a way that anybody can really understand, and staying on top of it to replying to emails, taking phone calls. Communication is critical in this role. So those are just a few. In school and in St. Joe's, and even in high school, we get introduced to these skills and we practice them. Um, but I don't know if any of the students out there like me. I learned through direct experience, and so applying it, taking the application from the classroom to the real world in a practical sense. That's when I really learned how to actually grasp hold of these skills and make them my own, and know how to use them and be tactile. And I oftentimes think, man, I wish I had this level of mastery back in St. Joe's. It would have been way different. But just to give some hope, if you don't have any of these skills on lock right now, there's still great potential for you to develop them. I'm still developing them today as we speak. I'm not perfect, and that's how I really learned them is through making mistakes and by failing. And I think that's something that a lot of us are fearful of is the fear of failure. But when we fail, or when we don't do as well as we think we would have liked to, um, the silver lining is it's the best learning opportunity because you did something, it didn't work, and now you have data and experience to analyze and see why it didn't work, and you have something to switch up. So I think failure is honestly, it may not be the most gentle teacher, depending on the failure, but it's the most complete, and you can really learn quite a bit. So not being afraid to fail, I think is what really taught me these things. I've messed up on POs, things didn't go smoothly. I didn't reply to an email. I had too much on my plate. I said yes to too much. It happens. We try not to, you know, um, let it happen, but it does happen. But we learn quite a bit from it. Absolutely, yes. If any of you are interested in anything that has to do with, like, let's say, process engineering or drug development, or even facilities management, real estate, supply chain management, those are all things that you can work on and develop skills into right now prior to reaching a position at Merck. I would say some practical things. You can look at project management courses. I know Google Coursera offers several project management courses that can help you understand the change management process. You can also look into SAP. SAP is the biggest ERP, that stands for Enterprise Resource Planning software. It's one of the biggest ERPs in the world. And if you have mastery over SAP, not only Merck, but almost any company in the world, you'll be an immense asset to. Those are two big ones I would say. Look into SAP and project management. Networking has been pivotal. Um, how I wound up at Merck prior to that was through hopping on LinkedIn and sending random recruiters messages and just looking at people's pages and saying, "Oh, they're in a role that looks really interesting. I'm reading about more about what they do. That sounds cool. Let me just shoot them a message and say, hey, I'm so and so. I'd like to learn more about what you do and see if we can connect. A cup of coffee, phone call." I've sent countless of, of those messages and may have only heard back from a handful of them, but the ones that I did hear back from, all of them absolutely actively changed the course of my life. Got me the job at Spark Therapeutics prior to Merck, where that was my first intro into the pharmaceutical GMP sector. And then through those types of connections, uh, just kept on progressing and progressing from there. So networking is absolutely critical. Um, Again, I think the common theme here: don't be afraid to be a trailblazer, and don't be afraid to take a risk and fail. And so you reach out, send that email, um, make that connection on LinkedIn. If it doesn't go anywhere, you can't fault yourself for not trying. But chances are it could. You never know if you don't try. So be proactive with your networking. Seek out those opportunities. We have at Merck something that's called the Early Talent Rotational Program, or TORP, and it's a 3-year rotational program at Merck, where students rotate through different employment opportunities in two different sectors: the Global Supplier Management Group and the Global Workplace Enterprise Services. Um, so the Supplier Management Group, those are the people working with supplier development and performance management, procurement, placing POs, sort of the kind of investigative stuff that I do, like really cool writing work, tech work, um, engineering specialist work, that kind of thing. And then your Global Workplace Enterprise Services Group, they're the facilities management, real estate, and sort of workplace experience group. And through this rotational program, you can you pick a pathway kind of and experience 3 years of work in all of the different groups. And at the end of it, you're offered a nice package and a job at the place of your choice, provided you perform. So that's an excellent internship opportunity. I work with some of the TWRP students currently in my role, and they're all brilliant, bright, ambitious, and I'm super impressed with all of them. And I thought to myself, we should definitely get some from St. Joe's. So look it up. It's called TRP with Merck. It's an early talent rotational program. If any of you are interested, please connect with me on LinkedIn. I will be happy to discuss further. It's more like, how do they not? I love Merck as a place of employment, because the diversity, equity, and inclusion piece is not just a talking point with them. It is a global company, and it is easily the most diverse environment I've ever done anything in academically or for employment. And not just in a physical sense. Yeah, we see people of all different ethnicities and races, and that provides one type of diversity. But we're also seeing just experiential diversity. We're seeing people who have different experiences in clinic, in employment, and background. We'll have someone that's master's in chemi or mechie, working along someone that's self-taught or that did a boot camp, but the quality of the work is equally impressive. Um, and just when you have those differences in experience coming from small pharma, coming from big pharma, coming from startup, coming from different types of process engineering, it really just gives a whole different meaning to out of the box thinking, because the stuff you can come up with when you have different minds that have been through different experiences is the stuff you can create is unprecedented. And that's what drives Merck's innovation, actually. It's this whole commitment to diversity, equity, and inclusion. Because when we have a diverse workforce, not only do we present differently outward, but we can think differently to derive very creative solutions to today's modern problems. And that's something that Merck prides itself on. Never have I ever been in such a diverse place, in every sense. Merck is excellent at that. And I think other companies should take notice and follow suit. Actually, that's correct, and in a way that I could have never foreseen. How can a master's in education launch you into supply chain management, engineering, with tech ops role? It doesn't make sense from the beginning, and that's what I want to sort of emphasize to the students. Don't be afraid to be a trailblazer and take risks that may not necessarily make sense at that moment, because we cannot predict and the outcome of any experiment. We have to run it um, with 100% confidence to get a definitive answer. Same thing with life. We have to do it to be able to answer it with 100% confidence. And those experiments and experiences, they can take us to crazy places we would have never foreseen. So be a trailblazer, take the risk, even if it doesn't make any sense, but let it be guided. And what I mean by guided is I thought about what is it that I like to do. I love puzzles. I loved scavenger hunts. I love critical thinking. I love technical writing, and I found a position that offers all of that. So I'm combining my BS information, my bachelor's in bio, with the chemistry work I did at Notre Dame, and studying how to learn as a master's student all translates into being an efficient worker in his technical ops role. So it's the combination of it, you know. So make an informed decision to be a trailblazer. I'll get a what's called a supplier notification from one of our suppliers. And when I say supplier, I mean a chemical company like Thermo Fisher Scientific or Bachem Chem that manufactures, let's say, a raw material. They'll send me the information for this raw material, and then Merck will say to me, one of the departments will say to me, "We want to use this material um, in X process but it has a Y expiry or shelf life. Is this feasible? Is this possible?" And you tell us. You're the technical ops engineering specialist. You tell us. And so then what I would do then is I would analyze the process, look at any of the stability data, and these are all things you guys have worked with before, things that honestly, as St. Joe's grads, I would feel pretty confident in you doing. Like looking at pH and saying, "Oh, the difference in pH would uh, it leads me to believe that this material would behave this way with this material." Or in organic chemistry, for instance, we have these different types of elastomers that we use for these stoppers. How will that interact, or how can we predict that stopper will interact with any of the fluids, the final products in our final fill, right? So it's using the fundamentals to make informed decisions about how things behave and whether or not things are feasible. And these are things that we've learned at St. Joe's, like different types of chemical reactions, different types of salts, ionic salts, and how they dissolve and how they behave, precipitate in solution. Different types of biological processes. We look at all that information when I write my technical memos to make an informed decision of whether or not we can extend expiry for this material to use in XY process. So I use it often, actually. And that's another thing about the job. I wanted a job where I didn't just, my bachelor's info was all historical knowledge, and it was it was a prerequisite. Checked it off, and that's the end of my BS in bio. No, I actually use that, and it feels good. It feels good. I feel like college is worth it now that I actually use it in my day to day. It's actually always worth it, but especially more so. So for my interview process, two of the things I really wanted to do was homework, make sure I knew as much about the company as possible, and then being authentic and letting my genuine interest in the work and in the program and in the company shine. So you always want to go into any interview prepared, meaning you know about the company, you know the drug products they manufacture, um, you know their impact, their stance in diversity, equity, inclusion, how many offices they have, if they are fully hybrid, remote, those kind of things. You want to do your homework, and then I loved the role. I was so excited about it. I really saw myself in the position, and I was authentic. I said out in the interview, "Hey, you interview a million people a week, but I'm going to let you know straight up, like this. I have a passion for this, and this isn't going to be just a job that I come in here for and sit down and you take the boxes, you get your money, and you go home. Like I feel fulfilled, and it'll be a personal connection because I found the role that encompasses everything that I would like in a position. Um, Challenges me appropriately, helps me grow. You want to find a job that makes you feel like that, right? And then you let that shine out of you, and whatever that is for you, whether it's being a physician, you're interviewing for residency positions, or even MS1 positions, or whether it's PA school or a research lab or PhD or whatever it is, you want to let that authenticity for what it is shine through because that's what that interviewer will remember, um, more oftentimes than not. And having interviewed myself, looked at interviewees myself, when you see so many faces come across and so many resumes, uh, the ones that stick out are the ones that they show a competent individual, but someone that really is going to contribute in more ways than just on the paper. So make sure you're contributing in more ways that are just on the paper. You want to bring that excitement and energy to a team because that is invaluable. And a company, a school, a position, a program will do anything to have people that do that. I asked for a description of the day to day, which they'll give you a job description, and you'll take a look at that. You start to get a sense that way, but then you start asking about the specifics of the program, and when you start getting into specifics, is where you can really start to piece together what this is going to look like for me. For instance, when I got the Merck position interview, I asked them, I said, um, we're looking at all of these different global changes. What's the workload or what's the case breakdown? How many changes do I have that are global versus locally managed? And then even though that all falls under change management, that was a good question because it allowed me to see, okay, I'm gonna have maybe 30% of my cases be site managed and the other let's say 65%, minus a few special cases, those 65% are going to be globally managed. So most of my site work is going to be pretty light, which will allow me to actually have time to do things like write expert extensions. So those specifics, you as the person interviewing have to do the due diligence to find those specifics, and then you have to ask how the specifics work in function, meaning what is the breakdown of this role going to be for XY program or XY seat or residency or whatever. And then you also want to ask for the specifics, how does this apply to me in this role? So you want to again specificity as much as possible, and that's going to get you an idea of how your day to day is going to be. Yeah, the master's in education. So my dad, Alex, he's been a school teacher for the past 30 years, right? And like I would go to school, I'd come home, he'd have me in his whole classes. So my whole life I was familiar with studying education. So when I reached this point, senior year, I'm like, okay, I don't know where to go. What felt comfortable was this idea of learning how to learn, right? Let me learn how to learn by learning how to teach. Because if you can teach something, you have to know it correctly and have a certain level of mastery over it in order to teach, right? Really worked out in my favor when we think about something as complex as chemistry, right? I'll be honest, undergrad chemistry was not the best for me, right? Um, Especially when we got into 10th grade. I remember Dr. Murray's OChem. Wow. So thinking about that, I was like, let me see if I can learn how to learn these complex topics and subjects, and then I'll have a mastery of learning how to learn anything, right? We take that experience in grad school, my master's in ed, learning how to learn. I come into industry, I come into pharma industry. It's a different language. I don't know anything, right? But what I do know is how to learn. How do we learn complex topics and subjects? There's so many different methods: visual learning, audio learning, tactile learning. We can do universal design for learning, instruction tactiles. We can do all different types of methods that if you weren't an educator, you would have no idea about. And so I applied those concepts, those learning concepts, and then all of a sudden, people at Merck they would come up to me my first in the first quarter, and they'd say, "How are you like comprehending this stuff and getting access to all this jargon so quickly?" Right? Um, and the answer I would say is, I have to shout out my MED. I have to give props to them because they taught me how to learn. They taught me how to take really complex, difficult, interconnected topics. And as someone that has taught those kind of things, I have an idea of how to structure it. And learning isn't just, you take the sheet of paper, you read it, you cram, you throw it away. No, you sometimes you got to step away from it for a day or two, right? Because there's time, there's called retention time, and that gives you time to let the concept sink in, and then you can actually apply it, and then you do a dry run, then you go back. Like there's so many different ways to do it, right? But all of that came from my MED, all of it. And so honestly, I would say 90% of the success I've experienced is in large part thanks to that MED. Because, not just learning how to learn, but organization, time management. I had 35 lesson plans to write, 35 exams to grade. If I can do that, I can find time to manage 35 changes, to submit 35 reports. I've learned how to manage things to that MED. So there's a lot of translational connection there, despite despite it being completely interconnected. I'll say that it seems completely interconnected, but there's a lot of connectedness there. Yeah, I wish I knew. I wish I knew, and this isn't anyone else's fault per se. It's just exposure. But I wish I knew that this existed. I wish I had more insight into the different sort of niche jobs out there. When I get asked what I do, it's a lot to explain. It's tough to do it sometimes because it's so niche. But there are really amazing, incredible roles out there that are also pretty niche that are tailor made for people that that enjoy these critical thinking, problem solving, like scavenger hunt like things, and do as much as you can to find them. Like even if you are in a field, you're doing research in a field, you think that this may not apply to me, or you may not like it, give it a shot anyway. Take the healthcare ethics course, or take the neuropsych course, or take something that is just sort of pushing your boundaries a little bit, your limits, your exposure. You'll be surprised what you find out. And I would say look for ways that you can tie things together. Um, Take your bio experience, for instance, and find a position that lets you utilize it in a way that's not just strictly bio, and that's not just strictly like, let's say, for instance, health in the physicianship role. Your job as a physician is strictly clinical based. You're in clinic. And no matter what you're gonna do, you're gonna be in clinic once you leave clinic and go to industry. In a job like what I'm doing, I am mixing bio with supply chain, with process engineering, with chemical engineering, with technical writing, with GMP planning, with audit support. So I'm getting so much experience, and I'm becoming. Uh, my boss yesterday literally said it's like the jack of all trades, Renaissance man trump card. You become someone that's very useful in almost every situation because you have a role that demands you integrate all of those different components. So look for opportunities like that, explore, push your comfort limits, and then just find out what you find out because there's some cool positions out there, some really cool niche positions out there. Oh, absolutely. Even I myself don't know too much about this, but Merck is doing some cutting edge stuff with ctDNA. Um, Whatever that quite frankly, I need to learn more about that. But ctDNA is going to be a pretty big thing in the next couple of years. Um, Regarding the industry itself, I would say automation, artificial intelligence, any ways you can make operations smoother from a supply chain perspective, that's going to be very welcome. Monitoring and tracking changes, so data analytics. And if any of you people are interested in data analytics, huge, huge, huge need for you guys. How we take data, how we make inferences and take that data, make it practical and get some usage out of it. Um, Engineering advances, ways that we can increase yield and in some of these manufacturing processes. Like how can we derive more precipitate if we're trying to increase our percent yield, or our theoretical yield is always going to be X, but shout out Dr. Murray. How do we increase our our percent yield, our actual yield, right? Those are very real problems in the drug manufacturing industry because we want to optimize as much product yield from each batch run as possible, right? So any of you engineers out there, innovation is needed in that sector as well. So to summarize, I'd say automation, AI, data analytics, and innovation and process engineering. Those are the main trends to be following if you're looking into the pharma industry. I really knew, I guess, when I would say I thought about working a healthy way. Like I would come home and then I would say, okay, like I actually kind of like for like it's more than just work. Like it was almost kind of fun for me, so to speak. So I'm like I'm getting some level of enjoyment from this. But take a couple steps back before I even got to the job. How did I know that I liked the field? Um, I had to do a lot of introspection, Tessa, I had to sit down and make a list of, what are my strengths, what are my weaknesses, what are things that I enjoy, what are things that I don't enjoy, and then I also had to look at from a practical perspective, right? If this is a degreed field, what is my expense going to be to get that degree, right? Um, I had to sort of paint a comprehensive picture of all of it, and then I had to decide as much as I can where I would enjoy myself. But hearing myself talk now, I don't think you can know definitively 100% until you actually get yourself out there and do something about that. Like put yourself in proximity with the field. So Tessa, if you're thinking maybe nursing, maybe it's nursing for me, shadow some nurses. And you said you did that. Oh, I don't like that. Okay, no nursing. Well, maybe it's research. Let me send 10 LinkedIn messages this weekend to different researchers and see if I can get into a lab. You might get one or two replies, but you set up an opportunity. You go check it out. Okay, maybe I'm feeling this. You do it for a little bit more. Volunteer. Do everything you can to put yourself in proximity until you get a feeling, until in that moment. That's how you determine anything with 100% definitive answering is you have to do it. Otherwise, it's theoretical. So I would say do everything you can to put yourself in just the position with that field, get some experience, and then your lane should be more clear from there. One last thing to the students, even if you have any other questions that you didn't ask, or if you think about something later, please feel free to just shoot me a message on LinkedIn. I'll be more than happy to connect with you. I remember being in your shoes not too long ago, So if no one's told you, I'm proud of you, all of you, for all the work you're doing. I very vividly remember being there. So keep up the good work. Good job. I'm proud of you, and go Hawks.